good day everyone. For today's video, I'll be demonstrating the postpartum perineal genital care to the mother. So let's start the procedure by introducing ourselves to the client and verify the client's identity and by using the two patient identifiers. So we're looking at it and can you state your full name, ma'am?
Smith.
So what do you want me to call you, ma'am?
Smith.
So okay, I will be performing the postpartum perineal genital care to you, ma'am. So the purpose of this is to prevent or eliminate infection, odors, and promote healing, and also to remove secretions and to provide your comfort. Is that okay with you, ma'am, to proceed with this procedure?
Yes, sure.
So once that the client give you the permission, so you can continue to the next step. So the next step will be the perform hand hygiene and observe other appropriate infection control procedures. And the next step is to provide clients privacy by drawing the curtains around the bed and closing the door to the room. So let's just imagine that I have closed the curtains and also closing the door. I don't need to close the curtain right now because we don't have any light here. So the next step will be prepare the client, prepare the equipment of the perineal care, and fold the gown up to the exposed perineal area, and then put the waterproof pad under the client's hips. So let's imagine that this is the pad, waterproof pad. So in here, so if you don't have any assistance, so you can put it on your own. So okay, gilid ka muna, ma'am. I will assist you. Okay na po. So the equipment will be the 6 washcloths, waterproof pads or the bath towel, the pair of gloves, so the soap, the basin, the laundry basket, the comfortably warm water, it is not required, not so hot, and also the bedpan, the perineal pad, and also the blanket for the patient. So the next step is to position the female in a back-lying position with knees flexed and spread wall apart. So like this. I will get your back-lying position. So next is cover her body and the legs with a bath blanket. So as you can see. So and then position and is at her head. The corner is at her head, and the opposite corner is at her feet. And then the other side, the other two is on her side, and drape the legs by tucking the bottom corner of the bath blanket under the inner side of the legs. Okay, so yes. And I will be going to put this one on her vagina area. So the next step is to don the gloves by using the proper technique. So, ayan. Then sa kabila. Then inspect sa kung merong mga butas. Okay. So the next step is to clean the mons pubis and labia majora, and then spread the labia and to wash the fold between the labia majora and the labia minora. And then use separate quarters of washcloths on each stroke. And then wipe the pubis area until the rectum area. And then for menstruating and postpartum women and also the clients with indwelling catheters, use clean wipes. Use clean wipes in each stroke. So next is to use the washcloths. Okay, so I will go to, and then wring the washcloth to avoid drip, and then I'm going to put a soap a little bit, and and also the next corner, and then we'll be going to wash the mons pubis to the anus and the side. Okay, the another side is we're going to other corner, other side, and next is to separate the labia in the middle to the anus, and then dispose. Next is the washcloth, and we were not able to put a soap because we were going to rinse it. So okay, so next is to put like this. Okay. First side on the mons pubis anus, the other side also. Okay, the other side, and then the other side is separate the labia. Same procedure. We are going to dispose, and we are using the 4 square method, or we call leaves method. Also, we must pat dry. No proper sequence, just pat dry. Okay, and dispose. And next is to cover the mannequin. Let's pretend that wala na siya. So next is inspect perineal orifices for intactness. Inspect particularly around the urethra in clients with indwelling catheter. So the next step is to clean between the buttocks. So we must assist the patient to turn facing away from you. So is it okay to you, ma'am?
Yes.
Okay, so the next step is to do the 4 square method also. So we must do also the 4 square method, applying to the vagina to the rectum. So okay, we must do another washcloth. and then put a little bit of soap. Another corner. And also the another corner. Okay, so let's put it here. So side. So let's imagine na lang na side to. And then another side, another leaf. Another side in the middle. Okay, let's pretend that it's a middle. And then dispose. And also, the next step is to use the washcloth without the soap. Actually, without the soap. And then make a 4 squares. Make a 4 squares method. Like this. The side. Next side, another leaf, and in the middle. Okay, and then dispose. And then another one is to pat dry. No proper sequence, just pat dry again. And then dispose. And then we must cover the mannequin. So we will cover it. The real client to cover. After that, we must remove the waterproof pad. We must remove the waterproof pad. So if you don't have an assistant, so you can just do it on your own. Can you turn, ma'am? Can you do it? Okay. Okay, ma'am. Thank you. So I will dispose it. Okay. So for the postpartum or menstruating women or a female, apply perineal pad as needed from the front to the back to prevent contamination of the vagina and urethra from the anal area. So next is to remove or discard the gloves. So we call it doffing. Okay, the next one is here. Okay, and then dispose it. And then next is to perform hand hygiene or the hand washing. Okay, ma'am, so we are all done. So thank you so much for cooperating with me, and you give me a permission. So thank you so much, ma'am. Next is to document any unusual findings such as redness, excoriation, skin breakdown, discharge, or vaginal bleeding. So for postpartum women, document the amount, color, and odor of vaginal bleeding by subtracting the weight of an unused or new perineal pad to that of the used perineal pad. 1 gram weight is equal to 1 ml blood loss. So that's all for my return demonstration about the postpartum perineal genital care for the mother. So hope you enjoy and learn my demo. Thank you so much for watching.